Vaccination gap. Let's go to NBC's Priscilla Thompson. She's in Bolivar County, Mississippi. Priscilla, thank you so much for being with us. How is the state explaining the disparity in who is receiving these vaccines?
Okay, see, I want to pick up on that stat that you mentioned. So Black residents, 38% of the population here, but only accounting for around 19% of the vaccinations, so underrepresented. But compare that to white residents here who make up 58% of the population, but have so far received 70% of the vaccine allotment. So they're being overrepresented in that data. And the state is saying, we know that this is an issue and we're working, quote, aggressively to shore up those issues and those disparities. But my colleague, Bracy Harris, lives here and has reported extensively on this. And what we're hearing from community leaders and also doctors is not that hesitancy and distrust is the issue, but the issue here really is lack of access to the vaccine. And I had an opportunity to speak with the CEO here at Delta Health, who operates clinics in this region, and he tells me that 85% of the patients they've vaccinated so far at this site have been Black, and that he has thousands of people on a wait list who are eager to get the vaccine. But one of the issues is barriers to access. Take a listen to what he said.
The biggest thing is trying to get online to register for the various drive-through sites that are offered by the State Department of Health. And the second thing is transportation to those places. Cleveland is only 9 miles from this location south of here, and many times patients are charged $25 for a one-way trip, and there's not a single traffic light between there and here. And so that's a big impediment.
And Casey, those issues are being compounded by the distribution, sort of the bumpy rollout that we've seen really across the country. But to give you an example, when doors opened here at Delta Health today, they did not know how many vaccines they were going to have for the week or whether they were going to get them at all. Now, they've learned in the past couple of hours that they should expect around 300 vials of the vaccine to be coming in, hopefully by tomorrow. But you can imagine how that makes it difficult for them to plan, for them to plan, for their patients to plan. Once those vaccines get here, they'll begin calling those patients on the wait list, but then those folks are going to have to figure out how to get a ride to get here and actually get that vaccine. And this community site tells me they are ready and able to set up mobile sites to go out into these communities and do the vaccinations, but they cannot do that when they can't plan for how much vaccine they're going to have and be able to distribute. So a pretty big concern here. Casey?
Yeah, incredibly difficult.